I've always been a person motivated by an internal drive, an unmitigated, relentless ambition that keeps me up at night. Recently, though, I've run into a problem with that drive. It's slowed. Fatigue crept in, brain fog, and even low feelings of self-worth. Do I even deserve the things that I get? And am I losing my edge? It's scary because that drive keeps me providing for my family and creating opportunities for others. It's what I do. I want more. I just can't seem to get to it. What happened to that little spark? Sound familiar? In my research to discover some helpful pathways, I ran into other colleagues, investors, entrepreneurs, real estate agents who were experiencing the same thing. The cure came down to a physiological thing that I could not avoid: time, age, gravity, and the impact of my ambition on my body. The doctors told me that I had low hormones and I needed therapy. Wow, therapy. What a good word, because sometimes we don't need a cure, we just need therapy so that we can keep on keeping on. It's been life-changing, so I wanted to bring my care provider to the show to share some wisdom and education with you. There's no one better than Samantha Neville, nurse practitioner in the Springfield, Missouri area. She's worked in surgical, orthopedics, cardiac, and ICU, and has extensive experience in GI, endocrinology, and finds passion helping patients in hormone, thyroid, weight loss, and anti-aging. I think you'll find our conversation to be most beneficial. It's educational and entertaining, and sometimes shocking. This episode is clean, meaning it has a G rating, but we put an explicit rating on the episode because it can get quite clinical at times. And in case you are a mom or a dad driving around little ears, I didn't want you to have uncomfortable conversations with your kids before you are ready. If you enjoy this episode, then please spread the word because people need this help. And if you like our podcast, please hit like and share now because it really does help us reach more people. Get ready to learn with Samantha Neville. And thanks for listening to our show. Well, Sam, thank you for being here. This is super exciting for me because this podcast is a little different than what we normally do. So this is a real estate podcast, but you know, it serves a lot of entrepreneurs and real estate agents who I know from being one for the past 16 years that we do a lot of unhealthy things. In fact, I know doctors do unhealthy things. Mm-hmm. You just described some unhealthy things that you did. But whenever somebody gets introduced to the real estate business, you know, after sometime in that first year, it usually comes out like, yeah, well, that's why we drink. You know, it's an extremely stressful position, and it is. I mean, you've got, what is it, like the top 3 things that people don't like to do or are the most afraid of, and one of them is public speaking. The second one is dying, and the third one is buying a house. You know, those 3 things are like the most like stressful, like fearful type things. So we find ourselves in a situation where we're operating with high cortisol levels constantly all the time. And we're trying to serve people. We're trying to mitigate disasters a lot of time, which is why, side note, Zillow will never replace the real estate agent. I don't know how technology could completely replace all the conversations that I have on a daily basis. And so thank you for what you do. And we've met because my wife and I, my family, we've got a membership at the place where you practice. And it's Command Family Health, and it's we've known Dr. Luke since he kind of got started, and he started Command Family Health, and then we got to meet you through that company. And sometimes when you have a relationship with a doctor and then they bring on some new doctor, it's the same with a real estate agent. People get used to you, and they have a hard time working with the person that you've kind of handed them off to or referred them to. But I never experienced that with you. Good. You are so very knowledgeable, you're so caring, and you also educate while you're doing that. And I know a lot of people may not want to do that in the medical field. There might be people that say, I don't care what you're doing here, just do it, just get it done so I can get out of here. Yeah. But in real estate, I've always done that, and I've always recognized the power of other professionals that educate while they practice. So thank you for doing that. I also wanted to say thank you for really a life-changing gift in the hormone therapy that I'm going to be very open and talk about on this podcast because I've seen such an incredible benefit from it. I've always said that I'm going to be one of those guys that kind of grows old gracefully. Some people are going to fight it kicking and screaming. And I think I've changed my mind. I want to fight aging, kicking, and screaming because, gosh darn it, I feel so much better when I've got testosterone coursing through my body. And so thank you. And
absolutely.
And
I'm glad you're feeling better.
Thank you. Yeah. How long have you been in the medical field, and what made you decide to go that route?
I've actually been in the medical field for 20 years. I started in '03. As soon as I graduated high school, actually, I knew I wanted to go into healthcare. And I knew it because 3 or 4 of my aunts were nurses. And so I was kind of around it a lot. And so a lot of people were like, hey, why'd you start? And really it's because my aunts were nurses. And then my grandpa and grandma got cancer. And so we took care of them in their house with hospice, and seeing that caring behavior really is why I actually went into healthcare in general.
Were you a teenager at that time?
I was, yeah. And so I think that was very influential. And then just my personality in general, I think, is just a caring nature person. That's just how I was raised, my personality. And so I think it was just a really good fit, honestly, of going to healthcare. I started as a nurse, and so for 10 years I was doing nursing, and I knew that I wanted to do something more after 10 years, that I felt like I had a calling to do something more in general.
What was it? Was it maybe a feeling of you're not learning what you wanted to learn, or you needed to be stimulated by a different part of the field?
I think all the above, actually. I think stimulation, like just wanting more knowledge in general, just always educating myself. And then also knowing that our healthcare system is broken, and seeing that. And as a nurse, I think it really frustrated me. And I thought, hey, I can't do anything to that extent as a nurse. I can work in the healthcare field, but I can't change it much. And so that's why I went and actually got my nurse practitioner degree. And that has allowed me, honestly, to do a lot more work independently with Dr. Luke at Command. For the last 6 years, I've worked with him, but I've been a nurse practitioner for 11 years. And I started my first career at the major hospitals here in this area. And I knew that at that point, it wasn't working for me because insurance dictates, honestly, what we are allowed to do and not allowed to do. And so if you know that a lot of patients come to you and they're like, hey, I don't feel right, but insurance doesn't allow us to run specific labs, or they don't allow us to run specific testing. So if you don't have a specific diagnosis for this, you can't run those tests. And so a lot of patients honestly are like, there is literally something wrong with me, but our normal labs don't pick it up. And so at that point I was like, I got to do something different. So with Command is a direct primary care clinic, and so we can run labs whatever we want.
Let's talk about that for the people that may not know what that is. It's really sort of revolutionary in the past, 10 years or less?
I'd say 10 years, yeah.
So I have a good friend who is a state legislator who is a orthopedic surgeon, and during his time in the Missouri legislature, he actually advocated strongly for direct primary care as a way to help families, because it's this new system, relatively new system, that allows people to pay a membership fee to have a doctor. And so certainly things like prescriptions or limited medicines, things like that, can be paid for above and beyond your monthly subscription.
Yep.
But it almost is reminiscent of the 1800s doctors that would do house calls. Now, you guys don't do house calls, but...
We do sometimes.
Do you?
Yes.
Okay.
Yeah.
So I guess when it makes sense, or when the person can't get there.
Yeah.
But it seems to be a lot more community-based, and I found it refreshing that we could just book a call, and it's all part of the membership, the monthly membership.
Yeah.
That's what direct primary care is.
Yes. So you pay a monthly membership, and with that membership, you honestly have about 24/7 access to me. I do sleep, so 24/7 is in reality whenever I'm awake, honestly. But it is, if a patient has something going on, if it's after 5 p.m. and they've done something to themselves, they don't know, should I go to urgent care? Can I come in and suture them up? I've come in and sutured people up after hours several times. So over the last 6 years, that's honestly at Command has been helpful to have that access to knowing that there's a different way to practice medicine, not just as a nurse practitioner, but Dr. Luke created it. His cousin kind of created the EMR system, so the electronic medical record that we currently use. So his family is really entrepreneurial in general. So I think that's been helpful having him as my collaborator. He really has been very helpful for me and allowing me to do what I love, which is hormones and functional medicine and weight loss. Like those things are very passionate to me, because over the last 6 years at Command, everything really goes back to hormones, or it goes back to the endocrine system. Not everything, but if you take care of those things, it really does help blood pressure and cholesterol and
headaches, weight loss, even
all of those things really go back.
Depression, mental health issues.
And you can go back to your endocrine system or your hormones, and those things are all affected based on our stress, what we eat and how we function in life. Stress really does affect all those things. So if we know why it's happening or how it's happening, it helps us better manage life in general, honestly.
Yeah, even sleep. I was reading that if a man has like a certain percentage of less sleep than what he needs to have, his testosterone levels could be like over 20 years a man his senior, right?
Yeah.
So, and I think that's where I got in my life, because just the stressful real estate career.
Sure.
And maybe not taking care of my body. I always tried to go to the gym as often as I could. And then actually Dr. Luke had identified low testosterone in me years ago. And I was like, nah, I really don't want to go through this treatment. I resist anything that doesn't belong in my body.
Sure. Yep.
And so I try to just hit it with natural means. I tried for a long time with diet and exercise, and I was able to get it to boost up some, but I just couldn't get it past that.
Yeah.
And then I started having some mental health issues, and then I was like, I gotta, when you research it, it's like, oh, it could be low testosterone. And actually, one of the agents in our office went into a local clinic, and they got some information, got some blood testing, and invited us to come and be part of a presentation for a very specific type of pelleting, right?
Sure,
Testosterone pelleting. And of course, I knew that you guys up at Command did that service. And so it made sense rather than just start a new relationship.
Sure.
I was like, hey, let's just go
Let's
talk
do
to
it.
you guys about this. What convinced me to go ahead and say yes to the treatment was the presentation, which was, if you don't, I can handle my own mental health issues. I have my entire life, and I've mastered them to the most part, to the point where I can function and succeed wildly. It's why I'm so good at helping other people pass them, is because I've mastered it on my own.
Sure.
But your willpower is only as strong as your environment, right? So constantly in that environment, my willpower falters. I'm like, okay, I need some help. But what I learned in that presentation was that it can seriously affect your predisposition for Alzheimer's and also heart disease. And that's when I had a wake-up call. And I was like, okay, let's go do this. And the thing that I was most impressed about when I came to you for treatment was that you asked me way more questions than they did. And you seemed to really care not only about my physical body, but about what it means relationally to get pellets in your body and to have your testosterone increase like 3 times. Because it is a massive change in your body. And it is a fountain of youth. I found, it truly is. I would wake up after the pelleting. I would wake up and do 100 push-ups before I left the house, just because I felt like I just wanted to, I had drive, And another thing that you said is like, hey, look, we need to check your spouse's levels too, and to make sure they're okay, because your sex drive is going to increase and that theirs may not. And that could cause a massive relationship issue. And I've seen it cause relationship issues in my friends, right?
Yeah.
That maybe haven't had that kind of
conversation.
Yeah. And I was so thankful for you to have that conversation, because Kelly and I were like, hey, are you ready to do this?
Yeah.
And so she was, so, lucky for me and lucky for her.
Yeah.
But it was, but even that is a source of joy,
Sure.
To have that part of your life, come alive again in a different way, and to have your cognitive abilities come alive in a different way, and to have my body, just looking at my body in the mirror, I was like, this stuff is
great.
It should be against the law. You know what I mean?
It is.
I mean,
good.
just seriously, it looked like I felt like I had atrophy. My body was wasting away, and after it seemed like a few weeks on these pellets, and I was like, oh my gosh, this is crazy.
I feel great. Yeah.
Yeah.
And it's just not just for men. Women really do need testosterone too. And when I do hormone stuff, I do hormones for women and men. Women really need testosterone. Testosterone is a sense of well-being. For men specifically, it helps them be who they really should be. I do that, honestly, for mental health, but also physical health, like you were talking about. High cholesterol, if your cholesterol's high, it increases your risk of heart disease. There's a lot if you aren't paying attention to your levels in general. And men's testosterone really starts falling around 35.
Does it?
It really does.
It's way earlier than I would have thought.
It's way earlier. And a lot of people don't want to admit it because they still feel pretty good. But after 35, it really does start dropping. And after 45, it's really dropping. And so most men, a lot of times if you have low testosterone, it's really, you just don't want to get off the couch and you just feel tired and you don't have any to do what you normally are meant to be doing, honestly.
It's not just sex drive. It's just like mental drive to conquer the world, which is what I've always tried to do.
It has a little bit to do with sex drive and a lot to do with your mental health and physical health.
I can totally agree with that, 100%. So talk to me a little bit about the process, because another thing that you guys did and I don't want this to be like a commercial for your for Command Family Health, although I would highly recommend it. But what I'm trying to get at is educate people on the process, because this other company that I was going to just said, look, here's the standard set of pellets, and you get this many if you're this weight and this age. But you ask me questions like, how do you feel about this? What's this area of your life like? And it seems like you try to target a dosage that's appropriate for the patient rather than the profile that the patient falls under.
I think there's two schools of thought when you're talking about hormones. So I'll say at Command, I started doing hormones probably about 6 years ago. I started really looking at functional medicine, looking at the underlying disease process. And functional medicine really is looking at why things are happening, not just treating whatever disease process with a prescription. It's figuring out what is going on. So for 6 years, I've studied intensely functional medicine. In functional medicine, a lot of things go back to your diet and exercise, and it goes back to your hormone levels. Even with healing, if you, hypothetically, let's say you injured your shoulder or something and you get PRP, which is platelet-rich plasma, which is a healing property of joints or ligaments, tendons. If your hormones aren't balanced, you're not going to heal nearly as quickly and as well as you would if you didn't have hormone balance. So it goes into all facets of everything we do medically. And so I started that process like 6 years ago because patients would come to me and say, I don't feel good. I don't feel good. And normal labs would be normal. And they're like, I still don't feel good. So I was like, there's more to it than just typical labs that we do in healthcare in general. If you go to a normal primary care clinic, because of that, insurance dictates what we can do. They're like, hey, your labs are normal. Sorry.
You can't get pellets?
Yeah. They're like, you're fine. But hormones, then you have to get hormones. And a lot of people don't specialize in hormones. If you go to a normal primary care that hasn't studied hormone therapy, you're probably going to not have a good outcome. Or they may put you on an oral medication. Men might get injections, which is appropriate if they are in the in a low testosterone level. But it's not the same if you're not really focusing on hormones for that specific person and looking at you and your family history, your relationship history. If you're not looking at all those details, yes, could I just give you a prescription and say, here you go? Absolutely. I don't function that way just because that's not how I'm trained. So 6 years of training of figuring out what works for you and doing more of an individualized care versus just looking at men in general and treating them with a dose. I'm looking at you specifically and say, hey, here's what's the best option for you. And looking at labs, checking labs every 3 months, making sure that things are where they should be and increasing, decreasing the dose, which is, I think, different because with direct primary care or a smaller company, and my new company that I've recently started, Evoke Health and Wellness, is specifically for hormones, functional medicine, weight loss. I can spend more time with patients with hormone-specific things. And it's different than primary care in some of the bigger organizations. You have 15 minutes to tell them what you need, and a lot of times you don't have enough time to explain it or
go into the educational process.
You can't educate in that 10 to 15 minutes if you even get 15 minutes. And we spend 60 minutes to an hour and a half to sometimes 2 hours with our patients. That way we can really educate. I do think the other difference, honestly, maybe I don't know if I should say this on, is that as a nurse practitioner, I've been trained for 20 years how to educate. That is honestly, as a nurse, when you're trained as a nurse, you're trained to educate patients. That's our training. And then as you go into a nurse practitioner, you're trained family medicine or whatever avenue you go down, actually. You're trained how to treat patients' illnesses. So I've had however many years, 10 to years of education, how to educate patients. And then I have my medical training, which is a nurse practitioner pathway to train patients how to treat diseases. So I have a benefit, and I do think a lot of times nurse practitioners have better education skills just because that's part of what we're taught in general before we even get into the medical stuff.
My brother-in-law is a nurse practitioner. And I mean, he's that family guy that we go to that we're like, hey, I'm just trying to be a good parent here. Should I take this to the doctor? And he does exactly what you described. He educates. And I never knew that about the nurse training. So thank you for that. That's interesting.
And I won't say physicians don't do it, but that's not what they're trained to do.
Gotcha.
They're trained to go in, see a lab or get a diagnosis and treat it. It's not part of their training to really educate. It's not part of our training to talk about diets either. Like medical or nurses, we're not really taught. You have to do special training for education for nutrition, which I've done too, but it's not part of our training, which a lot of people I think that it is like something we're taught. It's really not something we're taught in school.
You have such a varied experience in your training because in addition to hormones, you are also a specialist in GI issues and what else?
I would say that's kind of where I try to focus is GI issues, hormone issues, endocrinology like thyroid type things. Endocrinology can be thyroid or hormones. I try to stay in that realm. I like that realm, I think, because a lot of what we experience as patients come from that realm.
You just feel like maybe you can help people the most if you hang out there.
Yeah, I do. We do a lot of musculoskeletal injections and procedures and all that fun stuff, which we do a lot of at the clinic. But I do a lot of specialty testing, like hormone testing, but gut health testing that a lot of patients don't ever know that's even out there. Even providers don't even know it's out there.
Talk about that a little bit. The
GI stuff?
Yeah.
So I started actually in my nurse practitioner schooling. I did my thesis or non-thesis on probiotics. So I thought it was super fascinating on probiotics and how probiotics are very helpful for everything, and I used it actually for preventing specific diarrhea for antibiotic use. But in doing my non-thesis on probiotics, I learned that it was very important. The gut is a pathway to mental health, hormone balancing, like literally everything. So if you don't have good gut health, you're not going to have a good hormone production, downway pathways. It disrupts women's progesterone levels. So a lot of times if somebody has bad GI issues, you're going to have a lot of hormone issues as women. You also have it as men too, but not as much like hormone disruption. But for women, it's a big deal.
I always just felt like the more you learn about it, the more it seems like we're controlled by the bacteria that is hanging out in our bodies. Yeah. It's like if you craving sugar or craving bad things, it's these,
overgrowth.
It's these microbes craving certain types of food or sugars so that we can give it to them. And
there's some fascinating research on the microbiome of the intestines.
Talk about
They've had some research where they took 2 mice, which I'm not comparing humans to mice, but they took 2 mice. One was obese and one was thin, and they actually took the microbiome out of both of those, swapped it around, and the obese mouse become thin, and the thin mouse become obese because of the microbiome. So it's very fascinating, honestly, and we do sometimes, like specific things do transfer, like microbiome and gut bacteria and stuff.
Yeah.
I think in the next 10 to 15 years, I'm really anticipate that they find which microbiome really affects our weight, because it does really affect our weight based on how disrupted our microbiome is.
When they say you are what you eat, nobody realized that meant bacteria.
It literally is. Yeah. So
and
it's
like
very
also,
fascinating.
I mean, when I was a kid growing up in the 70s and 80s, it's like, hey, just give the kids some antibiotic, you know. And so, like, I was on Augmentin for like 10 years of my life for sinus infections, and it's like that's just super high-powered.
Yeah.
Antibiotic, it would give me stomach aches and things like that. And then the doctor was like, "Be sure you have some yogurt with it." And
now we need to fix your microbiome.
Yeah, exactly. I know. Gee whiz. No, I seem to be fine there. It's I'm not going to let you put any more needles in me or whatever that you have to.
Fair enough.
But it's fascinating. And so, how did you get interested in? Talk to us about the study that you've done. I mean, obviously you can learn in books and in school, but you had a lot of practical education in the GI world too.
Yeah. So I have a lot of specific training in anti-aging. So my extra education, if you were continuing education, is A4M, which is anti-aging like licensure certificate.
Okay.
I don't know what it's technically called, but in doing that, continuing
institution of some kind.
Yeah, I guess it is anti-aging institution. In doing that, A4M is for anti-aging, and so when you're talking about anti-aging, you're looking at the whole person and how can we keep you as young and healthy as possible. And when we look at that, we have to look at the microbiome, and then when we look at the microbiome of the intestines, it really does point to everything else. Our microbiome, if it's disrupted, it really will affect your hormones, but it will also affect your mental health. So there's more serotonin receptors in the gut than there are anywhere else. So if our microbiome in our gut is really disrupted, it will affect our mental health. So it also will affect our immune system. It affects our hormone production. So if we have a bad diet in general, if we're eating out all the time, fast food, it really will affect everything in your system.
Think about it. I mean, if it affects your mental health, that affects how you can show up as a mom or a dad.
Oh, for sure.
Or a spouse or a leader or a service provider of some kind. So I by now, people are listening to this thinking, oh my gosh, now I've got to fix this part of my life. This isn't to create more stress. But while people are thinking about that now, let's give them some tips.
Yeah.
And let's start with probiotics, right? So if you're looking for a probiotic or if you're looking to introduce a better schedule than what you have had in the past, what's the first thing you should do?
I will say the first thing, I'll go back to what I train my patients. There's kind of steps that we're taught what you should do first before you even look at microbiome is really mental health.
Okay.
But if we're talking about microbiome, talking about probiotics, getting a good probiotic, don't buy probiotics, don't buy multivitamins at Walgreens, CVS, Walmart, because they're just trying to purchase. They're just trying to get your money, honestly.
Okay.
If you're going to get a good probiotic or multivitamin, get it from like a Mama Jean's or a supplement store, because they take more pride in what they have on the shelf than what you would see at a big retail location.
Okay.
Mainly because they do a lot more quality checks. And if I'm going to go down the functional medicine pathway of saying, hey, let's make sure what goes in your body really is good, I want to make sure that if you're going to take a multivitamin, that it's going to be a quality multivitamin. So make sure that you get a good supplement. And so the probiotic that's been world studied is Saccharomyces boulardii, which is a yeast probiotic. You don't have to get that one specifically, but if you get a probiotic, make sure that you get a probiotic that has 4 or 5 different strains. You don't want to just have lactobacillus. You want to make sure that there's a mixture of 4 to 5 strains.
Why? What's the benefit
There's
there?
about a ton of different microbiome in your gut. So if you're only giving it lactobacillus, which is 1, you're not changing the balance or imbalance of the microbiome. So you want to make sure that you get something that has several different strains.
How long does it take to really manifest a change in your microbiome if you decided tomorrow to take a nice probiotic?
I would say that honestly, probably about a month, you should see a difference. And the way you see a difference, honestly, is more of what your stools look like. So bowel movements will be a little bit easier. They'll be softer. If you have chronic constipation, that really does say there's something going on in your intestines or in your microbiome that really needs to be looked at. Even IBS, I hate that term IBS, but IBS, diarrhea or constipation, there's something going on. And I'm looking at what's going on. I'm looking at food allergies. I'm looking at microbiome balance. I'm looking at stress, different things to really say, why do you have that specific diagnosis? Not that you have it and just give you a prescription, but like, what can we fix to balance out the IBS symptoms? Because really it is a symptom in that case. Now you could have like an actual Crohn's or ulcerative colitis or something, but hopefully by the time you get to a doctor, you kind of know, hey, something's different.
Right.
So, but in functional medicine, or at least in anti-aging, when we're talking about hormone production, health in general, looking at, you were talking about at the very first of the podcast, cortisol level. So when we're talking about hormone production or health in general, we're talking about mental health and building stress resistance. If I can tell anybody anything about hormones or weight, is trying to build stress resistance.
What is stress resistance?
I usually tell patients, hey, this is what stress resistance is. Because if you hear that, you're like, oh, that sounds fantastic. But what does that mean?
Yeah.
Stress resistance is really training your body to perceive stress differently. So stress will literally always be there. You'll always have jobs, hopefully. You'll always have jobs. You'll always have kids. You'll have coworkers. Stress is stress. Like, we will literally always have it. We can't really decrease our stress unless we change our occupation, which a lot of people don't. But really training your body to see stress differently and lowering that cortisol level. And one way, there's a lot of research on how to do that. And one way really is doing meditation, prayer, like just calming your mind and not having an agenda. And sometimes just doing that in the morning just to kind of relax and say, hey, let's start our day and calm down. I have patients say, hey, I don't have time to go on a walk. So walking outside 30 minutes really does help build stress resistance, or doing yoga, Pilates, exercises that aren't for exercise, but they're really to help our mental health, like learn how to relax and take deep breaths, are the way to help actually build stress resistance. I actually have patients that are like, I don't have that time to do it. So one thing that I teach my patients, a lot of people have Apple Watches, and the Apple Watch will say meditate or take a deep breath. That's actually because it's showing that your heart rate's high, and they can tell something's going on, or your watch can. If your watch actually shows that, I say, hey, at that time, literally take that cue, take some good deep breaths, relax. Try to lower your heart rate. Try to lower your cortisol level because your body's showing signs of high stress. And so if you can kind of start training your body to respond to that stress in a different way, you're building stress resistance.
I would just be frustrated at my watch for going off all the time.
I was
and
too.
Interrupting me, you know. So, but you're right. That's great advice. And I think if somebody doesn't have time to take a walk, that should be an indication right there.
Yeah.
That this is what's wrong. Like this is your diagnosis. Make time for a walk.
And if your cortisol is going up because you're stressed, whether it's due to your occupation or family or whatever you're trying to get done, if your cortisol level is going high, eventually it will get worn out. So you can get low cortisol levels eventually just because your body's just like, hey, I don't know what to do anymore.
Your adrenals are like,
your adrenals like, I'm done. I'm not going to work anymore. And then you're really, really tired. So you're stressed and wired and tired. And so there are actually adaptogenic herbs that you can take to help with that, which is a big term. But there's a lot of things you can do to help with lowering cortisol level or in encouraging that balance in your system with specific herbs and foods that you can eat to kind of help with that specifically.
Legal herbs.
Yes,
yeah.
yes.
All right.
Yeah.
Well,
ashwagandha. There's some good ones out there. Yeah, so there's a lot of adaptogenic herbs that you can take that are super helpful. And then the second thing, honestly, that I tell patients, besides cortisol is number one or stress resistance, number two is gut health. So gut health is number two. And then number three is weight management or hormones. So three, like those things are actually third on the list of like really trying to address. Because if you don't address your cortisol level or your high stress, it will literally affect your gut health, and your gut health will affect your hormones, which will affect your mental health. So it's kind of a big vicious circle.
Truly. So we've helped people understand what they need to look for in a probiotic and to start that as soon as possible if they want some benefit in 30 days. So somebody who's listening to this and thinking, well, maybe I should kind of get my hormone levels checked.
Yep.
First of all, how do they do that? And second of all, what questions should they ask a care provider to make sure they're finding a good one?
It's hard because if you have normal traditional health insurance, a lot of primary care providers might check hormones, or they may not, and they may refer you out. If you're not trained to do hormones, you can get a provider that orders hormones and says, hey, they're normal. I actually get patients' labs all the time that I review that providers like, hey, your hormones are normal. And then I look at them, I'm like, no, you're probably having some insomnia, you're probably having some hair loss, and this is probably what's happening. And they're like, yeah, but I was told they were normal. So if you're not trained to look at hormone levels, you may get inaccurate advice, or advice that providers they're not trained to do it. And so they look at a scale and say you should be between A and Z. And if you're between those numbers, they say, hey, you're fine. But if it's not balanced, or it's not for your time of the cycle or men's age, like it really does matter. And in normal healthcare, you just don't have time to look at that.
How do you find somebody that knows that?
Online, obviously, you can look at reviews, or you could go to Command if you need family medicine, or Evoke Health and Wellness. That's what that company, my specific company, is for hormones, specialize in hormone review. There's also different ways of doing hormone testing. So you could do serum, which is a blood test. You can do a Dutch test, which is a saliva and urine test. You can do a lot of different types of testing. If you're younger and you're still women, if you're still having menstrual cycles, I would do a Dutch test, because then it tells you how you're breaking down hormones, what pathways, because some pathways are good, some pathways are not. If you're just doing a serum, it doesn't always pick those things up. But finding somebody that does them, I would look at reviews and look at profile, I guess, if you will, if they do hormone management. I wouldn't see anybody or trust anybody that really doesn't mention that they do hormone management, because we can all draw hormone labs, but whether you really know what you're looking at, besides the basic, you're in these numbers, all providers can say that. Say, hey, your estrogen or testosterone are within these numbers, but it doesn't mean that they're balanced, and it doesn't mean that you aren't affecting your health.
And so just to help people understand, you've had such a surge in business at Command that you've had to open up your own department, and this is proprietary to you. You have your own company now up in Springfield called Evoke. Are you already taking patients?
I am.
Okay.
Yep.
And you're taking them in the Command office right now?
So right now at Command's location, I am currently remodeling my own space to do just hormone management and weight management at my own location in Springfield,
Okay, so you've had to be a real estate investor due to this because you're remodeling a space.
Yes.
But you said in our conversation that you did some flips and things like that.
Yeah. So
what's your experience in real estate?
I love real estate. If I wasn't a nurse practitioner, I'd probably do real estate. But I'm trying to think of how many houses that I think 4 or 5 bought houses, flipped them. I remodeled them. Obviously, we had some contractors help us out, but I love being hands-on. So I lay floors. I can lay laminate and tile, you name it. I love doing that kind of stuff.
Yeah.
I like to build stuff. My dad was great at teaching me how to actually build and work on cars and all sorts of crazy stuff. I love doing that stuff. I think it's the mechanic, the solving problems in my brain. I love to do that. But flipping houses, we bought several houses, flipped them, sold them, bought more houses, flipped them, sold them. I really enjoy doing that. I'd probably do it after my Evoke adventure settles down a little bit with hormones. Yeah. I probably will invest some more and flip them. And
you just need a good team around you.
I know, right? Yeah,
you just really need to say yes or no because you can have a real estate agent finding the deals for
you.
For
sure.
You can have a contractor doing the deals for you. That's what a lot of people don't realize, but Arnold Schwarzenegger became a millionaire by investing in real estate. This is before he'd even won any titles. Yeah. Because he's at the gym on a payphone working these deals while he's trying to go get wealthy because there was no money in bodybuilding at the time. So most people don't realize that about him, and that gave him the freedom to be able to choose the movies that he wanted and to do all the things that he wanted because he was already a millionaire in real estate. So you can still do it. You don't have to wait. In fact, if you wait, it's the worst thing you could possibly do.
It's probably true. Yeah.
Properties are going up in value.
Rates are going up. Yeah.
Yeah. You're on my team, right?
Yeah.
You're on my health team. You need people on your professional real estate team.
That is right.
I don't know. Maybe we could work something out here.
Yeah, we probably should.
Come in and get some pellets and then immediately learn about investing in real estate.
That's right.
Talk to our team. There's a lot we can do here.
There's a lot.
Yeah.
Sounds good.
You also told me that, you just got out of a surgery and you are, supposed to be taking like 2 or 6 weeks off.
I'm going to get in trouble for this.
And you're less than 2 weeks off. And like you're out
remodeling,
there, you're
building
working.
Stuff.
And so, I don't want to get you in trouble, but what I do want to say is that, so you are a person that treats people who are redlining like constantly.
Yeah.
And you also said that you're on call 24/7, and you've got all these things. So how do you balance your life being as smart and educated as you are and seeing the value of a treatment and a slower lifestyle, but also redlining constantly?
I think that's a great question. Currently, I'd say I'm not doing a great job at it, mainly because starting Evoke, I have to work my full-time job at Command along with trying to create a new business as well as have a family.
Yeah.
I'd say having surgery was probably the best thing that could have happened to me currently because it forced me to slow down a little bit. And so I've had to take 2 weeks so I don't rupture sutures and things like that.
Yeah.
My brain is still going, and I think that's just my personality of going. My brain just needs to be functioning in general. But I think it's important to take time. I'm learning that as I teach patients. We educate, but as moms and women and healthcare providers, we're not great at taking our own advice sometimes. Yep. I know that I should sit still for 6 weeks, but I'm not going to.
It's like a doctor that's smoking cigarettes while he's working on you.
No, I'm not going to do that. So I'd say I'm not sure I'm taking my own advice probably in the last 2 or 3 months because there's a shift in trying to take care of patients because I care so much for my patients. They're my family, honestly. And so for them to not get something taken care of, to me, would break my heart more than not getting something else done. So I'm going to take care of my patients before. My family's obviously number one, so I do still take a lot of time to make sure that I'm taking care of my kiddos and my wife, honestly. But outside of that, if I have a spare second, I'm going to be working because I feel like that's what my brain needs to do. Now, I don't think everybody's the same way. I think a lot of people do need to take some time. If you're building a company and trying to get it off the ground, I think there will be times in which you'll be very busy, but I do take time to take deep breaths. And if I notice that my watch is going off, I will literally try to just calm down.
Good.
Or in the middle of teaching a patient, if I feel that I'm amped up because I'm super excited about hormones and weight management, if I feel myself literally getting amped up in the conversation, I'll just take a deep breath and try to relax.
Micro break.
Yeah, so I'm trying to just tell my body, hey, it's okay. I don't always take that 30 minutes a day to go on a walk or do yoga or things like that, but I do try to take several like minutes throughout the day to try to reduce my cortisol the best I can.
Yeah, well, you seem to get a ton of joy from
absolutely.
just helping people. And I did the same thing until you get to a wall, right, where you can't anymore, and then you're not serving anybody at all.
Right, you have to take a break.
Which is why I understand, and I've talked to my pastor about this, and I think pastors in general are probably some of the most abused human beings on the planet just because they don't get credit for the true value they actually give the people that they serve. So they take sabbaticals. Professors are the same way. There's our society, whether you're a pastor or an educator, you get credit for taking time off and going to learn. That makes you a better pastor. When you fill yourself up, you now have the ability to pour out.
Yeah.
Teachers are the same way. And I realized that when I was growing my business as fast as I was, that was something that I did not do, is I didn't take time to go learn, because you can be your own weakest link. You can be the person in your business that you need to fire.
Yeah.
Because you're not the person that needs to be employed in the position that you're in. You know, I had to fire myself from a variety of positions that I was in because I was lazy at it. It was my company, but I wasn't the right person for the position.
Right.
I'd show up to work and I'd be like, oh, I'm going to poke this problem with a stick for 2 hours and complain about it before I actually do something about it. Yeah. And I should have just had somebody in there that did that. And also the hero business model that you're creating for yourself is not a scalable business model. And I know because I've also had that problem. That's why I ended up in your office, right? Because you can't be a hero to all the people all the time. You cannot have transformational relationships constantly. Right. You're going to profit off of the transactional relationships that you have, help people where they're at, and certain percentage of those relationships will be incredibly transformational. Right. Those people become your family because you know they would do the same for you, hopefully, right? Yeah. So it'll be interesting for you as you grow out Evoke to balance those transformational with transactional relationships, because I've gotten to debates with people about the word family, using the word family in your business. Some people don't like it at all. I do. I do like to treat family, my team like a family, but you don't choose your family, right? In some cases you do. You know, you choose your spouse. You choose children in some cases if you have adopted children, but for the most part, they're the people that you decide you want to stay together with, regardless of what happens. And I think that's the real distinction in business, because there's some patients that you may have you may not want to stay together with.
You're right. Yeah.
So how would you deal with me challenging you on the word family or your scalable business model? How do you maintain the level of care that you have for your clients and also separate yourself from them so that you can actually have moments of peace? How do you manage that with such a growing business and such a strong desire to love and care for your patients?
I would say this last year, I've learned to do that a lot better.
How so?
As a direct primary care that patients have our access like 24/7. Yeah. As a female, even in direct primary care, females tend to get taken advantage of by patients because we are, not necessarily men are not caring, but that's the estrogen in us makes us a little bit more
compassionate.
Yes. And so we get stuck in that with the direct primary care. Well, the last year I've decided, listen, I've got to set boundaries. And so I really did have to, with at least command, set boundaries, say, hey, I'm not going to answer text messages that are not urgent after hours, even though I felt like, I probably should. I wait till the next business day, because if I don't, I literally sometimes feel like I might lose my mind because I'm texting patients constantly.
Right. Because your real family
needs me.
You.
Yeah. So I would say the last 2 or 3 months with starting Evoke, it's been a lot more busy just because building a business. I've went to a lot of different continuing education on business development and like how to structure business the right way to start it versus a year into it and then figuring out you've screwed it up.
We've managed your expectations this way, but we're changing our policy. Right. We're taking something away from you. That's kind of an emotional withdrawal.
Yeah, so I think it's been a lot to start. Even before I've grown the business, I'm learning how to, one, create a business based on going to these different conferences, but I'm also learning how to train staff when I hired them from the start so that it is how it should be, that they can run the business by themselves. So as I get a little bit further in the process, honestly, hopefully I'll have less time that I'm seeing patients and more time with my family. And I've structured that honestly because I knew currently at Command how much I work with patients, that the new business, my intention is not being on call and being able to have a business that maybe I work 2 days a week for hormones and not have to work in primary care, just taking a very specific focus on specific patients, and then the rest of the time enjoying life.
How are you going to do that? What's your ultimate goal? Because you're already a successful and sought after care provider, and now you're starting your own business, so you can care for more people in that specific field.
Yep.
And hopefully leverage a little bit of your talent to produce more income for yourself, so that you can generate more freedom or invest in more real estate or whatever it is that you want to do. So what is your end game? At what point will you retire or not see patients, or what's next for you? What are you barreling towards?
I would like to say in 5 to 10 years, having a company that I really can be hands off. But in doing so, there has to be other providers that are trained similarly to me that can treat patients similarly. And I think it is coming up in like health in general. There's a lot more in Springfield, even hormone management kind of facilities, if you will, because we're realizing it's very important. But I think starting it the right way to start and making sure that I get paid for my education and paid for the quality of care that I give. I think it's different. Pay structure will be different based on the knowledge and the care that you give versus the one thing I did learn is not always basing your pay structure based on everybody else in the area. So that was very interesting. I went to a conference. Maddox was the conference, and the guy started actually with PRP, penile injections, which you can delete that out. But
no, what is that? What is that? It's
so
fascinating.
it's PRP. So men that can't do testosterone and can't get an erection, they can do PRP, so platelet-rich plasma in the penis.
As opposed to like Viagra, is it better than that?
It is better than that. Honestly, it helps, and PRP is a normal. It's your own body's blood supply, like your plasma, your own blood. Yeah. So it's not introducing anything foreign to your system, right? So
but convincing a guy to get an injection.
I know, right?
I mean, how do people deal with that? They're like, nah, I'll take a pill.
I think I'm okay.
Yeah.
It's because those patients typically have tried everything else, and they know that hey, none of this is working, and so
I'm sorry.
Sorry about that. You
Sorry,
have to get an
Matt. This is. What we've got for you.
You have an
really
injection.
It's the last treatment we can possibly give you. So sorry. I don't mean to make light of it because it's a serious problem.
It's a serious problem, and it's a treatment. Honestly, it's painless, even though it sounds like terrible, honestly.
Yeah.
Because you do numbing and different things.
Okay.
And the injection lasts really about 6 months, and so it's a really good option for patients. And so the guy that I went in and he taught us on how to create a business. That was his first business adventure, and he said the exact same thing that you said.
Yeah.
And he created a $1 billion company, and so he sold it, and he created more $1 billion companies. And so it's been interesting to hear him how he structured his companies and the advertisement that went into it and the pay structure that went into it. The conference I actually went to was actually for PRP, for joint injections and orthopedics, but it was also based on like the business side of things.
Okay.
And so PRP in this area, just in general, platelet-rich plasma runs honestly about $1,500 for a joint.
For one injection?
It's
or
a location.
Okay.
A location, if you will. At Command, it's definitely cheaper because you get that for a membership. But the point of the whole thing was don't base your pricing on everybody in your area. Base it on your education and your ability and your skill. And even if you're higher than everybody else because of those abilities, you're going to benefit long term, and so it helps your business structure based on your quality and your abilities. So just doing conferences and learning like how to create a business was super fascinating and very helpful for me.
It's awesome that you're doing that because most doctors do not make good business people.
Right. And that was the whole point of the conference, honestly. It was everybody that was in there was either physicians, NPs, PAs that want to create their own business, but they don't know what to do.
Yeah. So I've experienced it in my career in serving people in the medical field who want to be in real estate. You've got, for the most part, family practice doctors are decent business people.
Yeah.
Because they have to run a business.
Yeah.
Dr. Luke is a real estate investor. That's how
Right.
I met him.
Yeah.
He seems to be good at business.
Yeah.
And dentists, great at business because they have to run a business. But surgeons, very few that I've met, aside from the one that I talked to you about earlier in the podcast, most surgeons that I've met, they might hire a professional to do the things that they don't have time to do, like a real estate agent or someone to manage their money. But they don't listen to advice typically. They have for the most part, in my experience, I have dealt with a lot of people that had a God complex. I've found a lot of surgeons that do. I guess they're successful. They've saved a lot of lives. There's something that happens there to their personality, which God bless them for saving lives.
Right.
Have you experienced that at all, or
Yes.
what are your thoughts on that?
Them not being good business partners or God complex?
Or yeah, both. Yeah,
both.
Yeah.
I would say yes. I would say family practice providers typically are more down to earth, and they love what they do and they love people. Usually I would say, hopefully I don't offend anybody, but surgeons, those especially cardiac or neurosurgeons, because they're the best of the best, I think that they almost have to have a God complex because they are doing something that most people will never do or experience. And so they have to have some sort of
intrinsic
confidence,
reward or
right.
identity that reinforces their decision to go to work every day.
Right. So that's very common. And I would also say that a lot of physicians in general are not great, or NPs or PAs are not great at business either. It's nothing we're taught. It's nothing, even in school, we're not taught really how to do a lot of billing structure in general. So we're not really ever taught that. So if you want to create your own business, you essentially are doing it from the ground up, which I think in general, I don't think a lot of people are taught that unless you go to school to do that.
Not at all.
So...
And we're not taught to manage a checkbook,
right?
Much for millennials, that's a thing that you write
yeah.
numbers on,
Put
and
numbers
you take it
on,
to the bank and they give you money.
Yeah.
Is there anything else that we as the general public should be? Well, first of all, let me ask this: are there any resources that we can go to, or trusted publications, websites, magazines, podcasts, anything that we could listen to or look at that would help educate the layperson on some of this stuff if they wanted to know more?
As far as research, PubMed is a great place to go for research.
Okay, what is PubMed?
It's a specific website that is medical information.
Okay.
Google is not. I have patients come in and say, I Googled this, and they're dying of cancer.
They're terrified, yeah, I know.
So don't Google it.
Okay.
PubMed is a great resource. So good websites that are actually medical based are incredibly important. And then finding somebody in the community, honestly, that you can have a trusted relationship. Say, hey, if I want this done, where do I go? There's people in Branson, there's people in Springfield that you could really reach out to. And most providers are very willing to talk about it and give you education and tell you where to go or what to do. We all have our physicians that we refer to because we're familiar with how they practice and the things that they do well in certain circumstances. I may refer patients to one finger specialist because I know that they do a good job on hands or something. So when you're in the field, you really do kind of get to know everybody in the field the best that you can, and you can make good, recommendations. Yeah,
you should, in fact, ethically. You should be good at what you're good at and refer the rest. I think that's true among people that are really care about what they do and they want the best outcome for their client or patient.
I think finding a healthcare provider that's passionate about what they do is very important.
But how do you really know that before you go?
I don't know that you do.
Yeah.
I think when you meet them, also in general, thinking about, so let's go back to mental health.
Yeah.
I talk to a lot of young adolescents quite a bit, and I'm like, hey, counseling is fantastic, but not all young people will go to counseling. But in general, a counselor, finding somebody that meets your personality and that you feel comfortable talking to is very important. Same thing with finding a primary care provider or somebody that specializes in hormones. You may see a different provider and you're like, nah, that didn't feel right in general, but you might find somebody in the same kind of genre of medicine that you're like, hey, that really hit me the right way and I got a lot out of that.
Yeah.
I think so. You probably don't know until you've kind of met them
Yeah.
or referrals. A lot of my patient panel are based on patient referrals. I haven't had to try to get new patients in a very, very, very long time, and it's just word of mouth because friends say, hey, this Samantha does this up there, you should check her out. And then they come and, they enjoy what they hear. They feel comfortable with what I do or how I do it, or my relaxed personality, I think, is helpful too.
It is. In fact, just so you know, as I was talking to a colleague of mine that I don't see very often, I saw him recently, and he's from the Springfield area, and we just kind of talk and like, hey, what's new with you? And I was talking to him about my testosterone pelleting, and he's like, yeah, I do the same thing, and it's with Dr. Sam, and up in Springfield. And I was like, that's who I go to.
Nice.
and he was like, yeah, he went on and on about how great you were.
Good.
And I was like, look, I already know, and which is why you're here and why I wanted to share you with the world. Because this podcast is really just a summation of all the people that I find fascinating, all the things that I love. So thank you for caring about your patients,
Absolutely.
me being, and my family being one of them. And thanks for taking some time today away from yours to share this with everyone else.
Absolutely. I love it. Thanks for inviting me.
You betcha. And then we'll keep contact info for Evoke so people can get a hold of you. Get in now before she gets too many patients.
That's right.
Because she can
Before
only care
holidays,
about so many people. But thanks again. I really appreciate you.
Thank you very much.
Well, a big thank you for listening to the end of our podcast. I know your time is valuable, and I hope you got a few takeaways that are going to help you get a greater return on that time. I know you will. And if you did enjoy it, I'd sure appreciate a share or a comment. Feel free to subscribe for instant access to new episodes and offers. There's also a ton of free content and ways to learn more and engage more at WorleyRealEstateNetwork.com. Until then, we'll continue to bring you recipes for success and real stories from real people who, like you, are living out your divine purpose. And hey, God loves you. No matter what happens, don't give up.